might be, I guess, what can only be described as an onslaught of legal highs entering the market. Whatever the position on the legal status of drugs, recreational drugs are rarely discussed in terms of morality, which is really what we want to do today in this session. So considered morally rather than medically, or indeed in relation to crime, is there anything wrong with seeking altered states of consciousness? Is there anything positive about drug use? If drugs were legal, should we take them? To help us unpick some of these issues today, we have a panel of speakers who I'm going to introduce in the order in which they'll be speaking. To my immediate left, we have Roger Howard, who's Chief Executive at the UK Drug Policy Commission. To my immediate right, we have Professor Neil McKeganey, who's the Founding Director of the Centre for Drug Misuse Research within the University of Glasgow. His latest book, Controversies in Drug Policy and Practice, is available now to buy through Amazon. And to my far right, we have Dr. Michael Fitzpatrick, who's a GP and author of The Tyranny of Health, Doctors and the Regulation of Lifestyle. So each speaker is going to speak for 6 to 7 minutes to give us their thoughts on the issue. I'm then going to have a bit of an argument up here with them before we go out to the floor for your questions and points. So do you want to kick us off, Roger?
Thanks, Susie. I could embarrass you all right at the start, and I won't. I'll say that at the beginning. I could ask you, who's taken illicit drugs. Now, I won't embarrass you. You don't have to put your hand up because I don't know whether the special branch or somebody like that are hanging around. But if you look in this country, the 12 million people, roughly, 12 million people say they've used an illicit drug at some point in their life. And leaving aside all the very, very young people, children, who don't fit in that category. So I suppose the question is that 12 million, and whatever percentage in here would put their hands up, and in response to my question, are you all acting amorally, immorally? So that's our starting point, and I don't think you are. Susie mentioned at the beginning about pragmatism. The drugs debate is often constructed in terms of pragmatism, and I want to set the stall out right at the beginning and say unashamedly I'm a pragmatist when it comes to drug policy. But I also want to say that I think that pragmatism is infused with morality. It doesn't operate in a moral vacuum. And I think that, in a sense, that pragmatism in drug policy permeates, or is permeated, with strong moral values, which I think any sensible person can and should support. And after all, I mean, when you think about it, what moral value could have greater practical benefit than the saving of life, the improvement of health and well-being, and optimising public safety? But let's just start and at the outset and deconstruct this core question about is recreational drug use morally wrong? First, let's just think for a minute about recreational drug use. And second, what do we understand by morally wrong? And I'm no moral philosopher. I left my moral philosophy back at university many, many years ago, and I was having to drag up some memories. So a lot of you are going to be a lot sharper on this than me. The first thing about recreational drugs, we're obviously talking about substances that are taken for pleasure, not for medical purposes. And they include all the obvious ones like stimulants, depressants and hallucinogenics. They're psychoactive, aren't they? And I could probably hear some of you thinking, and some of you may have done it last night, well, alcohol is a psychoactive. We use it for pleasure. It's a good point. We need to hold that, don't we? But what about someone who uses heroin illicitly to cope with memories of childhood trauma or abuse? Is that recreational or is that medical? And I think that's one of the problems for those of us who want to separate appropriate drug use from what we might call wrongful drug use. And I suppose those people who say that drug use is fine when it's prescribed to solve a medical problem, but it's somehow sinful when it's for pleasure. Because really, what is the essential difference between that adult victim of child abuse going to a doctor for their antidepressants or going to the old dope peddler on the street, other than obviously one gives you quality control and measurement? And if you throw into that pot, and it's going to be discussed tomorrow, but if you throw into that pot mind-altering substances like cognitive enhancers or indeed performance-enhancing drugs that are going to bring pleasure to people and pleasurable benefits, then I think it gets a lot more, the waters get a lot more muddy. And I think that perhaps really the problem is that our understanding of what constitutes recreational drug use is in fact quite narrow. And some of the controlled drugs, which we colloquially know as illegal, obviously have medical pleasure-enhancing and mind-enhancing functions. But let's get hung up too much on definitions. Let's just assume for the minute somehow we can come up with a definition of recreational drug use that excludes use or treatment for any physical or mental condition. And what we're talking about is pleasure seeking. I still conclude, even if we're talking that way, that branding this drug use as universally wrong is in fact, I think, less moral in some way than a pragmatic alternative. Here's why. We could have a long debate, I think, here about what we mean by morality. The earlier sessions, this whole theme is about morality, but about especially whose morality. And I think to describe recreational drug use as morally wrong obviously means invoking a whole set of cultural values, social mores, and various codes of conduct. And obviously one moral value is about complying with the law. And perhaps drug use, recreational drug use of illicit drugs is wrong, technically, because the law says it is. But laws aren't immutable. They change over time, they change in space, geography, and you've only got to look at homosexuality and things like that. And there's plenty of examples about how the law changes. So from a technical, legal point of view, and moral from that point of view, I think you can put that to one side. Another set of moral values, and I'm sure this is going to be picked up at some point, is about freedom and liberty. And it's much discussed in this area, and I'm not going to say much about that, but it's a legitimate moral value, and people will say, as Suzy was saying, one person's freedom and liberty comes at the price of another, stuff like that. But another set of moral arguments is about the virtue of pleasure, seems to me, and dragging up my moral philosophy and things like that, and ethics. I'm struck by Epicurus, who says, that we should prioritise pleasure seeking over all else, of course, in moderation in some way. And a Stoic would, on the other hand, say that we need to restrain our pleasure seeking because we need to be better prepared for surviving the times. And I think all of those are valid arguments, but none of them gives us a sort of a consistent answer or a consistent compass about the morality of recreational drug use. And we need to be clear that there's nothing unique about the morality or otherwise of drug use. There's plenty of other behaviours which are harmful to the individual and to society. Some people argue that drug use is self-indulgent and lazy, that the pleasures it brings are transient, inauthentic. And my answer to that is, well, so what? People sometimes do a lot of things that are pleasurable and hedonistic, but which can be harmful and or unproductive, whether it's computer games, bungee jumping or drinking. And drug use, I think, recreational drug use, is not dissimilar. And this takes me, I think, to I suppose, what is my main point. If we're not treating drug use as a special case, and I don't think we should, we need to treat it like any other kind of human behaviour. And we need to weigh up, therefore, its impact very pragmatically, and we need to weigh it up in two ways. One is to obviously assess the harms that it creates, obviously to the individual, to wider society, etc. But there's the flip side to that, which is about recognising and acknowledging the pleasure that it actually brings. And some people argue that the way to achieve a net positive balance between those two is somehow if we can eradicate all recreational drug use And they say that because drugs can be so damaging, or for whatever reason, and the only way to minimise those harms is to stop people using them. And it might be true at one level, but I think it raises several points. I think firstly we need to know, I suppose that we've moved past seeing the use of drugs, I think, as having an intrinsic moral value, good or bad. And we need, and I think I start from a sort of agnosticism. And secondly, I think, is if we can overcome the fear of talking about benefits of recreational drug use, then I think we get a more agnostic, we get a more constructive debate about where do we go pragmatically next. And of course there are benefits from using drugs. Stopping people taking drugs has a cost in lost pleasure, as well as lost liberties. But I think we rarely take that into account in our balance sheet. And I can tell you, I sat in the advisory council of the misuse of drugs. All we're focused on is the harms. Nobody talks about sort of notional pleasures, benefit. And I think finally, at a pragmatic level, we've never succeeded, have we, really, in any modern, non-authoritarian society in eliminating drug use. And every attempt that we really have made has, in a way, I suspect, made an awful lot of other lives largely worse. It's also benefited a lot of people, but it's made an awful lot of things worse for those who continue to use the drugs, and often those around them as well. And I mean, you've only got to look at what's happening in Mexico to see that. And so I think it's just not accurate to say that reducing drug use necessarily leads to less net harms and more net happiness. And we have to recognise also that there is an inherent damage that was caused by our attempts to control it in that way. So if I conclude, where does it leave morality in this argument? I suppose some people might say, because we follow, and I follow like an agnostic route on this, that we've taken morality out of drug use entirely. But I think that actually underestimates the sort of my call for pragmatism. And surely the aim is to save lives, improve well-being and safety. And I start without that assumption or prejudice, an ideology or whatever, but with the passion for improving the way that we deal with all those saving lives, improving well-being and things like that. And I think at the end of the day, what could be more moral than that?
Thank you.
So I'm going to talk about this proposal from a position which there may be hardly anybody, if anybody in this room would agree with, which is that it is indeed morally wrong, and that we have, I think, to rediscover a sense of moral purpose in relation to how we tackle and understand the issue of drug use. And I think that framing the question as it is framed about is recreational drug use wrong is in a sense deliberately skewed to make it difficult to make the case for there being a moral dimension. Because after all, in a way, who could object, morally or otherwise, to a notion of a recreational behaviour? But of course, the distinction between recreational drug use and what other people might regard as more problematic drug use is itself deeply problematic. One person's intermittent cocaine use at a party on a Friday night might be their recreational choice. One person's heroin use in an inner city estate, more or less frequent than that, could be someone else's problematic drug using behaviour. So the distinction between recreational and problematic is vague. But setting that issue aside, I think it's quite difficult in some ways to say something controversial about illegal drug use, whether that's recreational drugs or more problematic drug use. I mean, we are accustomed now to seeing celebrities reporting their drug use, photographs of them using drugs. We're accustomed to senior police officers calling for the legalisation of all drugs. And it is as if there's nothing that one can say about the issue of illegal drug use, which is now controversial, other than the proposal that there is a moral dimension associated with the use of illegal drugs. If there is one term which is guaranteed to stir controversy in terms of how people think and talk about the issue of illegal drugs, it is the issue of morality. Indeed, we have drug policies in the UK. We have an English drug strategy, we have a Scottish drug strategy, which set out government policies in relation to illegal drugs, which make no mention whatsoever of a moral dimension. It is as if, for whatever reason, we have entirely absented from the whole domain of drug use the question of morality. Now that seems to me to be an unfortunate and hugely regrettable impediment, because the choices people make in relation to whether or not they're going to use a drug are ultimately moral choices. They're choices about, do you feel it is right or wrong to use drugs with whatever frequency and of whatever kind. And it is at heart a moral judgment that you make. And it seems to me that if one takes out the moral equation from the question about do you use or do you not use illegal drugs, you're left with a very partial understanding of the factors which might influence your use. One of which is the notion that it causes health harms. Well, we know that the majority of people who use illegal drugs, on the majority of occasions they use those illegal drugs, will not actually come to great harm, medical harm themselves. So, in relation to the question, should I use an illegal drug? If the answer is, well, it may cause you harm, statistically, the likelihood of that is so small that that is an inadequate basis upon which to make that judgment. Another might be, well, you're breaking the law. Well, indeed, you are breaking the law, but the likelihood of you deriving or experiencing any criminal penalty as a result of that drug use is statistically so infinitesimally small. Nobody would reasonably think that if I smoke this cannabis cigarette, I stand a chance of getting prosecuted. Indeed, for a heroin user to actually stand a chance of prosecution in our society, they virtually would have to throw themselves at a police officer displaying that they've got heroin in their possession, because statistically the likelihood of actually being arrested in possession of heroin relative to the number of people who have heroin on them and the proportion of time they're carrying heroin is so infinitesimally small that the criminal justice element does not really figure in the decision, should I not use an illegal drug. So in a sense one is left with the notion is, do you feel this is right or wrong? Now, many people think, well, that's a non-entity. How could you possibly have that discussion internally or with other people about your drug use? And that, in a sense, is where we arrive at, with a series of policies and cultural attitudes about illegal drugs that have actually taken morality almost entirely out of the question, wherein it is now almost bizarre to think that there is a discussion to be had about the moral nature of the drug use question. And yet, it isn't that long in historical terms when morality infused public policy. So, for example, child labour. We understand that was written out as an available option because it offended a deep sense of public morality. It wasn't because children were not adept at actually going down mines. We decided, however, that was a violation of our notion of moral worth, of a morally appropriate thing to do in society. Similarly, in relation to sex education, there was a time in Roger's teenage years and mine where sex education was conveyed in physiological terms. We now understand that it's an important element of sex education to understand that issues of power in relationships, of whether or not somebody is forced or encouraged to do something where they're not ready to do, is an important element of sex education. That a morally laden understanding of sex education is important because it reflects what we as a society would like to see, which is that people make free choices about what they're going to do or what they're not going to do, rather than they're pressured by other people to do things. However, in relation to illegal drugs, it is as if now it is entirely inappropriate to actually raise the moral dimension. And yet it seems to me that at heart, that is the dimension which must infuse all of our understandings about whether or not we get into and engage in patterns of illegal drug use. Because the other reference points are not particularly that influential in relation to that decision. But politicians, I think, generally are very, very fearful about having public debate of the morality of illegal drug use, and the perception is that drug use is an available lifestyle choice which the individual can do as he or she wishes. But nevertheless, we also know that the choices the individual makes can have a dramatic and negative impact on other people. So where you have drug-dependent parents, for example, and that one may say is not a case of recreational use, where you have drug-dependent parents neglecting for their children, there you have individuals who are adversely, and profoundly so, adversely affected by the drug use choices that other people have made. Now that's an extreme example, and it's not an example about recreational drug use, but it shows that the individual choices that we make can have a ripple effect on the lives of other people. And that, it seems to me, at heart, is why there is a moral dimension in this question. And I think that we will not be able to effectively tackle the issue of drug use until that moral debate is actually much more publicly engaged in. Because at heart, I think the question we have to ask ourselves is, do we want a society which is increasingly connected to psychological and psychoactive substances? And we must be under no illusion that the current array of psychoactive substances is only the tip of a potential iceberg. If we persist in a policy of pragmatism that says you don't need to make any of these fundamental choices, just do it if it's relatively harmless, and we'll provide treatment if you experience harms, what we potentially give rise there to is a limitless array of drugs which are then manufactured in laboratories across the world, and then are increasingly made available and become increasingly used and change the nature of public and civil life in our societies and our cities. And it seems to me that that is a very dangerous road to go down, and that instead we should rediscover the importance of morality in public life and ask the question, not does it satisfy my individual aspiration, curiosity, search for personal pleasure, but actually am I in my small way, in those choices, contributing to an image of society which is the society that I would wish to live in and my children would wish to grow up in. And that, I think, is why the moral dimension is so important, although most politicians have a failure of nerve and run a million miles away from the debate about the moral dimension of illegal drug use, recreational or otherwise. Thank you.
Thank you very much.
Thank you. Well, I must say I find myself in a much greater extent of agreement with Neil than I ever expected to in this discussion. And I particularly agree with his emphasis on the importance of a moral dimension to this debate. Like him, I would start from the point that it's much more useful to regard the whole debate around drug use from a moral rather than a medical or a legal, criminal perspective, which is the dominant frameworks within which it tends to be discussed. Moral in the sense of the question of what sort of standards of behaviour we hold ourselves to as individuals and what sort of standards we wish to prevail in the society in which we live and that determine our relations with other people. Now, we start from recognition that the use of intoxicating substances is a universal feature of human society. It's surrounded with all sorts of rituals, it's very pleasurable for individuals, it plays a very important part in all sorts of social life. And we also recognise that the resort to intoxicating substances in response to the vicissitudes of life is a permanent and ineradicable temptation and part of the human condition. As Thoreau said, most people lead lives of quiet desperation, and the resort to intoxicating substances or altered states of consciousness in response to that experience of life is a constant presence of the human condition. The problem arises, and Neil emphasised this, is when occasional or episodic use of these substances becomes habitual, customary, compulsive, it then can become a problem. And this problem, of course, as a society, we have existed with in relation to alcohol, which is the predominant substance for creating an altered state of consciousness and intoxication over many hundreds and thousands of years that we all kind of live with. And the distinction that Neil mentioned about there's a sort of a spectrum from recreational to problematic use. That is a problem that every individual in this society has got to learn to work out in their own personal relationship to alcohol. because of the way in which alcohol permeates our society. Everybody in this room has had to do that and has negotiated that, because you can't live in this society without so doing. And indeed, increasingly, that experience is extending now to other sorts of substances which are becoming increasingly familiar. Now, and we only have to look at the experience of alcohol to see the problem. Alcohol, on the one hand, is a substance which creates immense pleasure. It exists in an immense variety of forms. People get tremendous enjoyment about drinking it in all these different, making it and sharing it with friends, having part, all that. It plays a very important part in our life. We also know the tremendously destructive effect that people's relationship on alcohol can have and has had. Everybody in this room knows from their personal experience how the people's individual relationship with alcohol can be so damaging and destructive in their own lives, in the lives of their families, in the lives of the wider society. That is a problem for our society to deal with, the fact that it's subject to all sorts of political controversies at different times doesn't detract from the fact that there's always been a problem there. Now, that problem is in some sense compounded and extended into the whole area of recreational drugs, and however they define all the kind of drugs that people use. Obviously, the problems that those substances create are greater for individuals and indeed for societies for whom there is a lack of direction and purpose. The most striking example of that is look at the destructive effect of the relationship of alcohol on indigenous or aboriginal societies in various parts of the world. Societies which are in a particular sort of state of demoralisation or crisis have a particularly difficult problem with that. It creates a particular problem for individuals. It's a particular problem for our society in relation to people who are poor, demoralised, unemployed, the immature and the disaffected. These substances are a particular problem for people who are in that state of life. And it therefore is quite understandable people should resort to these sort of substances, and it can become a habitual, customary, addictive part of their life, where the whole process of drug consumption takes over from any constructive activity in relation to their personal or social lives. Now, in response to that, my medical colleague Theodore Dalrymple, one of the most perceptive of medical writers on this subject, he takes what you might take as an extreme view to say was, if society is going to stigmatise any activities, these ought to be stigmatised. Indeed, he put the addict ought to be stigmatised, because this behaviour is self-centred, self-destructive, self-indulgent, and indeed socially destructive. Now, it seems to me I would advocate the stigmatising of individuals and the social discrimination against individuals. But it seems to me that it's an entirely sensible position as a society as a whole to take a view of these activities as something which should be regarded with an element of social disapproval or disapprobation, and people should be somewhat, wherever possible, we need to strive for a cultural climate in which these activities are not encouraged. Rather than what it seems to me exists at the moment is the way in which these activities are indulged and in some sense rewarded. The celebrity culture celebrating this has been mentioned. But on a smaller scale, one of the interesting things is the extent to which a population now exists which can claim disability benefits on the basis of being addicted to alcohol or drugs. There are now 100,000 people in this country in receipt of long-term benefits with a diagnosis of either alcohol, about half and half between alcohol and drug dependency. Now, and that's doubled in the last 10 years. Now that's a very interesting social trend that has been created in our society, that that activity is, in a sense, supported and indulged by the rest of society. And one of the striking features, been some discussion in the medical world recently of the problem of ageing addicts. We now have a population, I've got a couple of patients myself graduated into old people's homes with their Zimmer frame and their bottle of methadone walking along with them. And what that, I think, communicates is the extent to which the admission into the category of addiction is a lifetime sentence. It's a career it's a self-fulfilling prophecy which lasts a lifetime, and people are condemned to a life in that respect. So I think we need to move away from that sort of support of the culture of drugs and indulging it and supporting it in those ways. And we should not celebrate this whole thing as this way of dealing with the experience of modern society as being in some way interesting or creative. As a slogan goes, a drunk is a drunk, every heroin addict is a philosopher. Pete Doherty is a cult hero of our era, and that seems to be a morbid feature of contemporary society, that we have these sort of folk heroes of people who celebrate this sort of condition. Or the idea that, which is one of the great illusions, an illusion well discussed by Theodore Dalrymple, going back to the Romantic poets and De Quincey and Coleridge, that whole tradition, the idea of creativity being enhanced by these substances. I haven't got time to go into that now, what a myth and a delusion that is. The alternatives to this trying to create a different, and I'm not saying that any of these activities should be banned or clamped down, I'm saying the kind of cultural climate, it seems to me, we ought to seek to foster around them. And that seems to me to be consistent with this wider bringing the morality of the issues into focus. The alternatives are to be regarded as a medical problem or as a legislative thing. Just briefly on those things. You know, this is the consumption of drugs. It seems to me cannot be construed as a medical problem. This idea that as a disease is a fatuous notion to me. You know, that it's a problem because the problem actually is not about you know, medical conditions. It's a problem that people have not learned how to live their lives in a real and meaningful way. And that actually is a problem for which doctors have got nothing to offer. I can tell you, as I've worked in this area for 30 years, the doctor cannot tell you how to live your life, greatly as though many of them may be tempted to do so. And that is eloquently confirmed by the complete ineffectiveness of medical treatment. For this, but we could discuss, we want to discuss the efficacy of medical treatments, so-called purported for these things. But what I object to is not the fact that the treatments are useless, but how dehumanising the treatments are. The notion that they have a reduction of the drug addict is reduced to a sort of physiological system which can be blocked with some drug, detoxed by replacing one drug or another, or some sort of automaton which will behave in a criminal way if the drug habit is not replaced with something else. It reduces the human being to somebody without any control or volition over their own behaviour, without any capacity to change their behaviour, without any control over how they live their lives. And it creates, you know, on the other hand, that's the paradox of this is a kind of warm glow of benevolence on behalf of doctors and health professionals who believe that they're being helpful in these relationships, when in fact they're removing all humanity from the people that they're treating. The concept of harm reduction, I think, is very interesting in this regard. You know, the idea that you have a state policy which reduces the harm associated with activities which individuals undertake. And that is an inherently infantilizing concept. What it does is to say, the state will take over from you as an individual the judgment of what is safe for you to engage in, and really, you know, takes responsibility away from you for determining your own behaviour. Nothing could be more reinforcing to irresponsible behaviour than the philosophy of harm reduction. The legislative alternative, which is the notion that's proposed as an alternative to that. There's much discussion about decriminalisation of the drug problem, which tends to be extremely simplistic actually, and one of the issues about it is that when people talk about decriminalisation, you say, well, what do you actually mean? What they usually mean is some change in the legislative framework, some different form of regulation rather than the current form of regulation. It's anybody that it seems to me wants to make out it's a simple problem doesn't understand the complexity of it. And you only have to look at the history of alcohol to see that. You know, Western societies have struggled with how to regulate alcohol for 200 years, manifestly unsuccessfully. And a triumph in that area doesn't seem to be anywhere near coming around. It's simple if you argue it from a basic principle. Basic principle which many people, and I hold dear to, is Mill's idea of the principle of non-interference in private behaviour. What the individual does is up to the individual, and the state should not interfere in it. Very sound principle to which I strongly adhere. But you can't also ignore the fact that there's a cost to be paid for that. And you look at the cost that society pays in relation to that. There is a cost to be paid for that you can't just entirely dismiss. You can look at it entirely pragmatically. This is the spirit in which Roger Howard introduced the discussion, to say, look, the harmful consequences of the war on drugs are even more than caused by drugs themselves. I think you can make a persuasive argument out, and people are familiar with that discussion around that. But I would say, yes, there's a case to be made there, But, you know, can you really be sure that the legalisation, the removal of all legislation would not create even bigger problems that we already have in relation to the flow, and particularly the commodification of these drugs that are now becoming increasingly widely available and the promotion of them on the market? Would that indeed do less harm than the current regulation? Maybe, maybe not. It seems to be open to discussion. Now, on balance, many people, including my colleague Theodore Dalrymple, he comes down in favour of continuing the criminalisation of alcohol and of drugs in the current form. On balance, I come down in the opposite position, because it seems to me that the principle of individual autonomy, particularly in the current climate of more coercive and repressive state legislation, is a more important principle to stand by. And the danger of infantilisation of social policies in all areas, the danger of intrusion in people's personal lives, the danger of the intrusive sorts of social and public health policies is greater than the dangers of drug use. Indeed, there's a sort of soporific, stupefying effect of all those sort of policies, which could argue is even nearly as bad as methadone. But more important than I'm going to wind up. More important than that discussion about legislation, however, is the wider question. I think this is where I very much agree with you. It's not really a question about laws. It's a question of the moral, cultural, social climate that we create around it. And I think that's what we need to really tackle, the baleful effects of the drug culture and the drug treatment culture. And we should make a start, I should say, repeal the laws, close the clinics, stop the benefits. And the take-home message we have to people from that is take responsibility for your own actions.
Okay, thank you, Mike. Niels, you specifically talked about celebrity, drug taking being a lifestyle choice. Mike, you were talking about the culture of drug use. So I just want to ask all of you for your thoughts really on why you think there is, if you like, a drug culture. You know, why has, if you like, social morality changed to a point now where it's kind of accepted and glamorised? You know, why do people do it? I don't know who wants to start, perhaps. Do you want to come back?
I think there's a damn simple answer to that. It's pleasurable. It gives pleasure to people. That's why people start using it. That's why 12 million people have been, have experimented. 2 million odd people use cannabis a year. They clearly derive some benefit from it. Now, there might be underpinning reasons for that, whether it's infantilising, whether it's shallow lives, or whether it's poverty or whatever. But I think there's a simple thing on one side of an equation, a set of scales, that people derive a perceived benefit from it. And we discount that. In all what I heard from Neil and Mike, I didn't hear the comment that people are doing it for some reason. Tell me, what is the reason they're doing it for?
Well, Neil, do you want to pick up on that?
Well, I actually agree with Roger in that respect. I think that people do largely, at least in the early stages, engage in forms of drug use for reasons of personal pleasure. I mean, you don't actually have to talk to many people who've been dependent for very long before you recognise the speed with which the pleasure element is diminished, and their continuing drug use is not about seeking or finding pleasure at all. It is about overcoming the unpleasant effects of drug withdrawal. But I think the question about pleasure, why in a sense would that seem uncomfortable in relation to the sorts of things that I said, and positive for the sorts of things that Roger said? And it is in this sense that somehow pleasure is the most important principle that should organise our everyday activities. That somehow, if it's pleasurable for me to do something, that gives me a carte blanche reason to do it. And I think the issue that I'm trying to raise in my response is that actually there may be another principle which is rather more important than the question about my individual pleasure. It's what is the impact on society more broadly of the small individual decisions I make about my drug use that I think are okay, and the decisions which other people make about their drug use, which I might actually feel are quite wrong and injurious and adverse to society, but mine is okay. I think that is a morally bankrupt view. And I think the proposition that it's okay because it's pleasurable leads you ultimately to the dereliction of any sense of collective responsibility, which to a degree we have lost in our public life. that we orient to the world much more now than in former times in terms of saying, well, what do I want to get out of it? What benefits me? What are my interests? What are the sources of my pleasure? And we feel almost discomforted and somewhat archaic to raise the question, well, actually, there may be another set of questions you should be asking yourself, which is about how do the choices that you make contribute to other people's welfare, other people's well-doing, and a healthful society? And I think that it is that element which needs to be important in terms of how we respond to the drugs question. But I entirely agree that often the onset of the behaviours themselves are about seeking personal pleasure or curiosity or a wish to explore, which in themselves they're not negative characteristics, but carried to the nth degree, whereby they become the only reference point. I'll do it because it's pleasurable. That, I think, leads ultimately to a dereliction of a sense of morality in public life and leads to destructive rather than positive consequences.
Okay, thanks, Mike.
I agree 100% with that, and I think Neil argued that very articulately. I think it's a distinction between, the notion of life pursued in the pursuit of hedonism, simple pleasure, and the pursuit of a good life. It's a sort of ancient Aristotelian distinction, and I don't think there's any great mystery why people take drugs. It is good fun, it's very pleasurable, but it has a somewhat limited scope in life. And when it becomes the whole focus of a whole culture, a whole focus of any particular individual's life, its limitations become apparent. I mean, this is, I think, abundantly obvious in relation to everybody's personal experience of these things. I mean, I remember as a student, everybody taking LSD and we said acid, it really expands your mind and opens up new horizons and altered states of consciousness. And I remember all these people taking acid, they were just as boring after they'd been taking acid. In fact, they were more boring because they were recounting their acid trips all the time. It changed nothing, actually, about their personality, except to reinforce often their rather negative characteristics. And I think you see that. I remember watching these late-night television programs about these people who go on holiday to places in the Mediterranean where they just have drinking games all the time. And they just drink, and then lie on the beach and get burnt all day, and then go and drink again. And you think, well, what sort of holiday is that, I mean, but that's accepted as a good time, that's a good life. Well, it just seems to me we have a culture in which that's so low expectations about the quality of life and the sort of life that we ought to encourage people, especially young people, to be living, that's regarded as virtuous and interesting and fascinating and creative. It's just boring.
Can I just come back on a couple of points? This thing about pleasure and maximizing, don't be under any misunderstanding that I think that is the only moral value that counts. The important thing is that we're dealing with a whole set of moral values that are in creative tension with each other. There is one about maximising our happiness and pleasure, and there's the other about protection of others and not creating harms. And there is one about the morality of the law. And so I think the thing about it being right or wrong, there's a whole set of different moral values that are in tension with each other, and I think it's an open question. Does one trump the other? And how do we decide that? What process do we go through from doing that? And that's why I think the second point for me is the inconsistency that we have in this, because Mike mentioned about alcohol, it's a psychoactive substance, quite clearly. Yet we have a very different set of moral values and codes that we apply to that than we apply to drugs that are currently called illicit, that are controlled. So it's this inconsistency that we have in our application of moral values and moral interpretation that seems to me to be, creates a lot of this dialogue, creates a lot of the confusion. And I'm unashamedly in favour of minimising the harm that these substances can do to our society, to individuals, families or whatever. But in doing so, in recognising that, minimising the harm as a legitimate, pragmatic, political and policy response, I also acknowledge, and I don't dismiss and negate, the fact that they give pleasure. So what legal, what other frameworks, what other moral values we attach to those are, you know, to me, I think quite fundamental. Consistency is absolutely crucial.
Okay, well let me just push you on that before we go back out. I mean, what is the difference, if you like, between alcohol and drugs? I mean, people can drink socially together, they might share a joint socially together. I mean, what is it about drugs that's making you react so, you know, vehemently?
I will comment on that, but I wanted to just respond briefly to something that Roger said, which was the proposal that the most informed or beneficial response to illegal drug use is a limited, pragmatic and policy response. Now, to me, that's an absolute bloody lost phrase. I mean, who on earth knows what limited, pragmatic policy is? It's bureaucratic speak for an avoidance of the question, is it right or is it wrong? Which I think the simplicity of that question is what should infuse our debate about illegal drug use. We can get lost in the bureaucratic terminology of limited, pragmatic and policy response and actually completely fail to address the question to ourselves, not only to other people. Is it right or is it wrong? And it is that climate which I think we should foster, where we put that question to ourselves. Not when someone offers us a cannabis-laced cigarette or encourages our children to smoke a cannabis-laced cigarette and says, I'm giving you this within the context of a limited pragmatic policy response. I mean, that's just complete madness. Because we know at our hearts, truly, whether something is right or wrong. And if we don't know that, we wish to indulge in the discussion, is it right or is it wrong? And I think that that is what is truly important here. Now, in relation to the question of consistency between illegal drug use and alcohol, it is forever the argument made that the policy response to illegal drug use is inadequate or hypocritical or inappropriate or misplaced because it is not applied with equal force to alcohol. And indeed, that may well be the case. And it may well be the case that the answer to that is, well, alcohol should be actually more prescribed than it is within our society. The answer to the problem of the inconsistency in terms of how we tackle illegal drug use and alcohol may well not be to license illegal drug use more widely than it is currently. It may well be to prescribe alcohol use much more widely than is currently the case. We have accepted alcohol in virtually every facet of our public and family life, not to the benefit of our society, but to the detriment of our society. The actual health-related consequences of our alcohol problems eclipse the level of health-related problems associated with illegal drug use. However, there's next to nothing that we can do about that now. We are in Scotland trying to wrest control from the alcohol industry by pursuing a policy of minimum pricing for alcohol. We have a government that is struggling to get hold of the epidemic of alcohol use, which has got out of control in Scottish society and in many other societies. Now, the inconsistency between alcohol and illegal drug use doesn't lead you to think, well, we should replicate how we deal with illegal drug use by the policies that we've pursued in relation to alcohol. But it also seems to me that the real worry in relation to, for example, some of our illegal drug use, if you take heroin, the real worry about heroin is not that its actual use is widespread. The real worry is because its use is so minor in society that we have a society where less than 1% of the adult population use heroin, and yet the consequences of that problem are so catastrophic. The level of problems that 1%, 300,000 thereabouts is the estimate of the number of people who've got into difficulty with heroin use. The number of problems that 300,000 people generate in terms of the health problems, the criminal justice problems, the problems of childcare are so substantial that virtually all our systems are creaking at the seams and unable to cope with the problems that are being generated. Now, if that figure were only to double, if the percentage were to double from 1% of the adult population to 2% of the adult population, our society could literally not cope with some 600,000 heroin addicts in our society. It could easily cope with 600,000 alcohol-addicted individuals in our society, but it can't cope with that level of heroin addiction in our society. And that, in a sense, is why I see the problem in the way that I do, that we must be absolutely determined not to accommodate the level of increasing drug use in our society, but to do whatever we can to reduce the level of drug use in our society. And I think that it's a proposal which would apply with equal force in relation to alcohol, although one would have to be wildly optimistic to believe that we have any chance of reducing the level of alcohol consumption to what is the current level of illegal drug use consumption in our society, because that battle is entirely lost.
Okay, thank you.
Yeah, I think these are very difficult judgments. I mean, the judgment of whether alcohol does more harm than good, is a very difficult one. But it's existed in our society for a very long period of time. There's no question it causes enormous damage. The question of the relative damage caused by drugs, I dispute the actual extent of the problems caused by that number of heroin users, but I don't think there's much doubt that the current policies are tending to encourage its expansion rather than to discourage it, though the numbers seem to be falling in the UK for one reason or another anyway, and changing into other drugs. But I think the arguments that I've tried to put forward on the moral issues are broadly the same as far as both these issues are concerned, because the issue it seems to me is not that first of all to try to challenge the prevailing, which is actually, I'm surprised there's so little been said about, because the prevailing response to this whole set of problems is to medicalise them. And there's a general idea, and in fact that's a humane alternative to the way in which these problems have traditionally been dealt with. That applies to alcohol and to drugs. And that's the dominant notion of how to do it. That seems to be, for the reasons I've indicated, entirely the wrong approach. And that's the same with alcohol and drugs. And that's now been extended into the drug thing. I think that there's more of an anxiety around the drugs because the problems are relatively new, and there are new drugs coming along all the time which intensify anxieties. And understandably, there's a concern to try to avoid the problems that society as a whole has had with alcohol taking place on any kind of similar scale with drugs. It seems to me the way to go about that is by pursuing the kind of moral case that I've argued, rather than further medicalisation or legislation.
Okay, thank you. And we'll come out now to take some questions. Where are the microphones? Okay, I'll start down this side, please, with this gentleman in the white t-shirt.
I feel that some of the speakers who are saying that drug use is morally wrong are kind of essentialising the bad aspects of it, and that you're kind of presuming that, well, to a large extent, all drugs cause bad results, and that in sort of like all cases, and this is an empirical question which you haven't really found evidence that drugs do create these massive harms on a particularly regular basis. And secondly, that you're kind of as part of the assimilation, you're kind of presuming that drugs cause problem drug use, which is not necessarily the case. There are other parts of people's lives and other structures in society that cause the problems created by heroin addicts. And I know that Michael said that it's sort of infantilizing to tell people this isn't your fault, it's some other thing that you should make your own decision. I don't think it's particularly infantilizing to say to somebody, look, you live in a society where you're affected by other things, and you have made decisions based upon this thing here. We can change these structures to change how, I'm not trying to force you to behave differently. I'm trying to give you a different, to make you live in a different situation so that you can rationally choose something else.
Okay, thanks. Can you pass the mic to the lady in the blue, please?
Hi. When you first started talking, I really agreed with you on the kind of, we need to have this moral discussion. I think that's really important. Personally, I've taken a few drugs in my life, but 2 legal ones, which were smoking and drinking, and over the course of my life have curbed the amount I've smoked and drunk, and in fact I don't smoke anymore. But I think that's the thing about growing up, and when I was young, I made a decision not to take hallucinogenic drugs because I was a bit scared about what would actually happen and what my brain would create, and maybe that makes me a bit more interesting, I don't know. But it was a decision that I made when I was young, and I did explore drugs when I was young. I made mistakes, I did very stupid things, And like Mike said, I curbed them because I realised I was being antisocial, I realised I was doing myself harm. And the thing that really worries me, Neil, about the point that you're making, even though I totally agree with you, we should have a moral discussion about it, is I'm not sure what you're advocating. Because you started to talk about, up in Scotland, we're going to do minimum pricing, we're going to do this, we're going to do that. And I think the whole process of growing up as a teenager, you start to explore things. And actually, when I first smoked, it wasn't pleasurable. It was actually disgusting. I had to teach myself to enjoy smoking, actually. I think that the whole process of growing up in society is about looking in, investigating these things, realising what is the right thing for you, you know, how you can make a positive contribution to society, and where you want to pursue your life, and what is antisocial and what isn't antisocial. If you start to bring in policy measures that curb the, you know, minimum pricing and all this kind of thing, are you actually allowing people to grow up and make those decisions for themselves? And that's where I think the danger is.
Okay, thank you. I just want to take this gentleman in the hat, then back to the front here for the gentleman in the black.
Okay, it is a very, very complicated subject, and I think I'm about to make it more so. It's maybe, if you're not familiar with the area from a neuroscientific basis, it's difficult to credit what I'm about to say, but go with it as a theoretical, I would ask. So I would invite the panelist's comments on these two ideas. In the not too distant future, we will have better drugs, in quotes, and by that I mean with less pernicious side effects. In other words, the drugs that we have now, about which you're theorizing, are not the drugs which we will have in the future. It's perfectly possible that we will have highs which are not at least physically addictive and send you off to work quite happily on Monday. Likewise, that's countered by the idea that we're likely going to be able to inoculate people for certain kinds of substances. We'll be able to prevent psychoactive substances crossing the blood-brain barrier. And so, according to your individual biases, how do you feel with the immense power of these two ideas? One, just a little comment I'd like to make relative to the idea of creativity and drugs having no particular link, or that being a myth. Bill Gates makes fantastically terrible computers. I forget the name of his company, but there's this other guy, but he's dead now. But anyway, the guy who's dead now said of Bill Gates that he wouldn't have made such terrible computers had he taken LSD. And indeed, just quickly to say, there is a basis for creativity neuroscientifically relative to dopamine. Dopamine is a reward chemical, but it is also a pattern spotting chemical, which is why in creative industries cocaine use is rife, and this is why all the unfunniest comedians you've ever heard don't touch drugs.
Okay, thanks. Can I take this gentleman?
It's always, social, antisocial. I mean, alcohol has an interesting relationship to gregariousness and bonhomie, and that raises some ambiguities that the panel have dealt with a bit. I think they could grapple with them a bit more. But I'd actually like to ask about the appeal of more sort of introspective forms of stupefaction, hallucinogenics and other drugs. I think those sorts of altered states of consciousness are very compelling and appealing, and I suspect one of the reasons they're compelling is because they involve undifferentiated experience, which can be a very enjoyable state. It can be akin to sort of a mystical epiphany. It can also be nightmarish as well. But undifferentiated experience can be very pleasurable and compelling. But it can also be very infantile. It's almost a replication of the state of mind we come from as infants, before we engage more actively with the world, before we engage more actively with other human beings. So while it's very understandable that we might want to go back there also seems to be something very problematic about that, perhaps even morally problematic. And I'd be interested to know what the panel thinks about that, and also, if they agree, how do you make that point morally without being moralistic?
Okay, thanks. I'm just going to quickly come back to the panel and then come back out again. In particular, it would be good if you picked up on this point about individual judgment and growing up, because I know that, Roger, you kind of quite keen to make policy along the lines of the least harm, and Neil, you've talked about perhaps making alcohol more prescribed, and I'm just wondering, where is the individual in this who's able to make decisions about their own tolerance and their own decisions about how much to drink or to take drugs and all that kind of thing. So Neil, can you just respond to the points?
Yeah, I mean, although I think that there is an important role in public policy for government intervention, for example, in relation to the alcohol. The alcohol industry is so powerful, its mechanisms to advertise and to influence behaviour is so far-reaching and so profound that I think it is a domain where there is a rightful need for legislation. Whether or not that is a minimum pricing of alcohol is yet to be seen, but I do think there is a role for that. But I don't think it is a role which obviates the necessity for the individuals to make their own judgments, and it is in that sense which I feel that there is a real importance to retain the moral dimension in how we, within ourselves and with our peers, discuss the issue of illegal drugs. Although, as I said in my opening statement, in a way, we have largely taken out the moral dimension from the drug use question. The question about what future drugs may arise and might science be able to inoculate us against certain drugs, that will happen. To a degree it is already happening, but none of that in a sense obviates the choices which individuals make. I mean, laboratories in various countries will produce new substances with shocking rapidity, and through the internet they will be marketed with astonishing impact and taken up by consumers across the globe. And the answer to that, in a sense, isn't regulation at a national or international level. It is in the judgments which individuals make. So whether medical science can actually inoculate against the effects of a certain drug, to a degree, is neither here nor there on a global scale. What is here or there is the decision the individual makes as to whether or not they want to engage in this behaviour, which in a sense is the choice that you made from your adolescence through to your adulthood. And it seems to me that young people do make those choices. And what I'm advocating, in a sense, is that we should rediscover the moral dimension, which can have an influence on, and young people can subscribe to the degree that they wish to those arguments, informing the judgment about their own drug use. And it's that which I'm arguing for.
Okay, but you do think that there should be more regulation. I mean, you wouldn't want to see drugs decriminalised, so isn't that a bit contradictory to say, on the one hand, you want young people to rediscover their sense of judgment, but on the other hand, you actually don't want them to go near these drugs?
It isn't arguing for more regulation, because they are currently illegal. I mean, drug use, heroin, and I'm not arguing there should be more legal impediments to heroin, cocaine, cannabis, because there is already legal impediments to those substances. And I actually do feel that those are beneficial impediments, and certainly when you compare the level of consumption of alcohol and heroin, they're an entirely different league of level of consumption in societal terms. And a part of that is the fact that heroin is illegal. So you have fewer producers, you have less over advertising, it is harder to access, although some people certainly do find them easy to access. It is not as easy to access as alcohol, and that is in part because the substances themselves are illegal. And although I'm not arguing for more legal impediments or barriers to be put in place, I certainly would not subscribe to the idea that the existing legal barriers should be dissolved in quite the way which I think Roger would argue.
Okay, thanks, Mike.
The question of the balance of benefits and harms of different sorts of drugs, obviously very complicated, because the different drugs, the balance is in different places, and there's a big problem of the disconnect between pharmacology and the legal position. I mean, look at this whole argument over classification. So you've got ecstasy as Class A drug, which millions of people have been taking in clubs for the last 20 years, the vast majority without any ill effect, yet it's, in the extreme classification. So I think, but on the other hand, there's no doubt that the habitual use of many of these drugs does cause significant harms. There's, I think, an abundant literature on heroin and cocaine in particular that it's very clear that can cause significant damage to people, and wider damage to society as a consequence of that. The interesting, but then the question is always then associated with that is there some deeper creative contribution possible of these sort of drugs? And I think that's a difficult question to answer. I think that to some extent there is obviously clearly historically creative people have discovered advances to their creativity through hallucinogenic drugs. Lots of people who are not very creative have not been so endowed. So, that's, what can you make of that, And no doubt some people have taken lots of drugs in the hope that it would make them creative and been rather disappointed at the results. The issue of the advances of neuroscience, I quite agree with Neil's point about this. We're already in this. Peter Kramer wrote this book about Prozac 20 years ago, Better Than Well. The whole thing about Prozac, in a sense, was that it was the new Soma, straight out of Aldous Huxley. A drug which people could take, which would make them feel a bit better. And there will be more drugs like that. And that's going to come in all sorts of different forms. I think, as Neil said, I completely agree with that. People have got to work out for themselves, and people are entitled to a much better quality of information than they have at the moment about those things. But it's up to people themselves to find their own way. As somebody described here, the experience all of us have had in various ways. Through alcohol, through drugs, and we find our way in life. You've got to do all these drugs. Everybody's done them all. As somebody say, put up your hands up. Everybody puts their hands up. It doesn't tell you anything. You live in this world. You've got to do all those things, but you've got to find your way through it as well, and unfortunately there are casualties.
Okay, thanks, Roger.
I want to pick up a couple of points about a couple of statements made that we've taken the moral dimension out of drug policy, and I don't think we have at all. I think that's an absolute travesty of what is actually happening. If you look at what public attitudes, if you look at what political attitudes and things like this is unashamedly saying we want to protect lives, we want to improve public order, etc., etc. We want to allow young people to have a meaningful, good life where their school performance is not diminished by virtue of being stoned out on cannabis or whatever. So I think in a sense this pragmatic, what Neil accuses me as a bureaucratic, pragmatic response, I think Neil is being entirely inconsistent, and he's actually advocating some of the things that he's saying he doesn't want. He calls about a bureaucratic response. Well, what is minimum pricing but a bureaucratic response? What is controlling opening hours but a bureaucratic public response? What is giving people nicotine patches to try and get them to cut down on their cigarette smoking and reduce the harm? It's an unashamedly pragmatic, harm-improving policy response. So you can't at one level say this is all devoid of moral values. It's steeped in moral values about protecting people.
You want, in a way,
before you interrupt, let me just finish. You were talking about me wanting to dissolve legal barriers. On the contrary, I do not. What I want to see is a different sort of control and regulatory framework in place. Personally, an organisation, we do not believe in legalisation for the reasons that Mike said about commodification and commercialisation. You don't necessarily want to go down the pathway of what's happened with drink and tobacco. They're not exactly very good examples. Equally, the harm that we do to people, giving them criminal records and all these other things, is equal. So we need a bureaucratic. Again, I don't mind being bureaucratic. That's what politics and policy is for. You need to implement that. So let's have these moral values and let's be consistent in their application.
Okay, I want to go back out to the floor because I'm conscious a lot of people want to speak. Can I start with the lady who is in the grey top? Yeah. Okay, it's on. I'm really conscious that this debate seems to be happening in a complete historical vacuum. The idea that we have a modern drug culture that is somehow different from what's come before is ridiculous. I mean, forget the 60s. Cocaine and opium used to be completely appropriate additives to children's cough drops. And at some point along the way that changed, and I think it's really important to look at why that changed. So the history of why certain things become illegal as drugs is very instructive to these kind of debates now. If you look at cocaine in the States, the early arguments against cocaine use and against and in favour of legislation against cocaine was basically that cocaine made black slaves more virile and stronger and encouraged them to rape white women.
You see similar anti-Chinese arguments for making opium illegal, and anti-Irish immigrant reasons for prohibition. And I think that's important now when we look at why are certain substances illegal and certain substances not, and why do we view some substances as morally different from others. I think you can't see that as independent from how we view the people who we think are taking these substances. And I think this is definitely important to the arguments currently about alcohol use. I don't think you can see that as something other than a debate about class at the moment in society. And I think it's important to look at that as well when we look at other substances. To what extent are we worried about the kinds of people that are taking these substances rather than the substances themselves?
Okay, thank you. Could you pass the microphone to the gentleman in the blue shirt here? Forward there. Yeah, with his hand up, right next to you. There you go.
Neil says that we've taken the morality out of drug policy. In a way, I agree. I mean, the laws themselves, Dangerous Drug Act and the Misuse of Drugs Act, were pretty largely based on morality. I would agree that in the wider drug debate that you tend to hear about, the morality has been taken out. But I think everything else has been taken out, except for public health. I think we've allowed the public health movement to completely invade the issue of drugs, as if the health is the only aspect. And both Neil and Roger have kind of epitomized this in a way by talking only about the harms. The great doyen of this is David Nutt, who's said that looking at the basis of harm, that alcohol should be a Class A drug, LSD and ketamine should be basically decriminalised. The problem with going down this route is that users don't look at drugs or alcohol as being only an issue of harm. Most of us probably go out this evening and have a few drinks. We might bear in mind the possible health implications, but it's not the overriding factor in our behaviour. So why should it be the overriding factor in the policy? And I think that Neil's kind of shown where this leads, because I don't think there's many people in public health actually would seriously want to legalise drugs. I think it's more a matter of looking at alcohol and tobacco, which have kind of slipped through the net, through the prohibitionist net in the last 100 years, and they're going to clamp down on those two things. So I think we're looking at more prohibition if we only look at the health effects, but why should we?
Okay, thanks. Can you pass it back to the guy with the paper in his hand?
Something came up in the first session this morning, which was character. And would it be worth replacing morality with the notion of character in this discussion? Because character informs how you would be looking after yourself, your self-responsibility, your responsibility to others. And if we return to the Mill's notion of the harm principle, I think I'm right in saying that Mills was a teetotaler. And that harm principle poses the notion of character, both for those that do drink, in the Mill's sense, and Mills who decides not to. And I think the discussion, sort of following on from the chat there, it's posed in medical terms or health terms. Maybe if we take the word morality out of it and force us to think of character and what does it mean for character, putting ourselves at the centre of it. And we all choose, I have a drink and I have a smoke. And in the morning I wake up and I think my character slipped when I had that cigarette. But I enjoy it. So we all grapple with these problems all the time, throughout our lives and constantly as we are. But I think asserting character and our individual character might be more helpful.
Okay, can I take the gentleman at the back standing up, please?
Hello. This morality issue, I think at the present moment is working its way into drug services. I work in a drug service. I have done for quite a long time. We now have a recovery-based approach. I work for a service that encourages clients to get better quickly by forcing them to go through the methadone, Subutex, Suboxone process as quickly as possible and then give something back to society. Form little groups of other ex-users and support society. Now, the state brought this in, so I'm slightly concerned about it. I don't greet it with open arms, but then I'm aware that I'm supporting a system that pays my rent. But the thing is, that's very important actually, because it's also a service that gets paid by results. The first year of our service, if we don't get the results we're supposed to get, we lose a quarter of the budget, which is £1 million quid. I mean, I see my view of recovery in the individual clients. Those that have always kind of, it's not an instant thing. They don't wake up one morning and think, I want to recover. But those that have always struggled with their drug use and have always tend to be quite successful. They tend to come out the other end as recovered drug users. But I wonder if it's cheap. This is why I probably agree with Roger in some respects. It's a cheap way of dealing with people. And those methadone clinics that Mike talked about earlier on, they're going to become less and less. There's going to be none of this. I've actually heard this in meetings. There's going to be none of this 10-year, 20-year methadone programs. People will be in and out in 12 months whether they like it or not. I suppose my concern is that of, say, this group of people, I would argue maybe 20%, 15, 20%, consistently commit crime to support their drug habits. That 20% will be filling up jails, and I agree again with Roger that sending drug users to jails are a waste of time.
Okay, thank you. Could I just take this hand here in the blue shirt? Please try and keep your point short.
Sure, thanks. I was interested in what Michael Fitzpatrick said about treatment. So you said, as if in a throwaway way, let's shut down the treatment centres and cut the benefits. But I rather sympathise with that, but particularly with treatment centres, is your main thought that treatment just either doesn't work or doesn't exist? Or is it that it somehow should be denied to addicts for other reasons? As just the first, I think it's a point worth expanding, because there was a sort of, particularly in America, there's this idea that you send people to something called treatment, where until recently they were taught to believe that they were powerless over this mysterious disease that they had of addiction. And they could, in fact, they could never recover from this. They could recover, but they couldn't be cured, and this might go on forever. Whereas, in fact, the truth seems to be that most people get over this sort of problem, do so because they decide at some point, this is intolerable, I'm going to exercise my free will. And I just wonder whether that thought is getting into the whole treatment industry business, or whether you still think that treatment is just something that shouldn't be done.
Okay, thanks. I'm going to ask the panel to come back in really 2 minutes each only, so that we can get another round of questions in before the end of the session. So Mike, can I start with you, please?
Well, Irving Welsh famously said in Trainspotting, rehabilitation is shite. It means the surrender of the self. And the trouble, I think, the most kind of bottom line of it all is that if you look at the figures, the statistics of recovery are no better than what would happen spontaneously. So that's, and there is in this whole world generally, as in many of these public health kind of medical type initiatives, a process of moving the goalposts to define what success is. So success used to be defined in terms of abstinence, now it's defined as staying in treatment. You know, so now I appreciate the points made at the back about there is now a tendency to try and curtail the length of treatment. It remains to be seen how effective that is going to be, because the whole experience, there's been many attempts to do that in the past, but it just simply perpetuates itself, and people will shift from methadone to subcutaneous to these various other alternative forms of medication, and then there's a whole discussion about providing people with heroin itself in some form or other. So it doesn't work, is the most obvious point about it is. But the effect of it, the very existence of it then, is to create the idea that this is a miracle solution. People are constantly coming to me saying, can you get me into rehab, and then everything will be all right. And there's a revolving door of rehab detox programs. But the underlying problem with it, it seems to me, is the whole concept of addiction that underlies it. And this comes back to the public health. Somebody made this point about public health being the dominant influence on this whole discussion. And I think that's true, and it's very significant, because public health is the sphere of the world of health and medicine generally which has the greatest contempt for the individual. Because to the world of public health, it's like doctors have patients. Public health people have a conception of population, and it's a population full of people who are dirty, given to dirty habits. They drink, they smoke, they eat too much, they don't take any exercise, they're slothful, slovenly, idle. You know, that is the public health conception of the individual. And the concept of addiction is very much fits in with that, because that's the idea that not only are these people given to all these filthy habits, but they're incapable of doing anything about them, because they're locked in these compulsive behaviours dependent on drugs or on some other notion of dependency, can even be defined in psychological terms, for which some sort of long-term therapeutic intervention is required. And the whole thing creates a machine of self-perpetuating, infantilizing, authoritarian in its relationship with individuals. It's very demoralising for individuals. So in other words, by removing responsibility for individuals for their own behaviour, it actually reinforces the wider culture within which these problems arise. Because when you're talking about these sort of behaviours, you're talking about 25-30% of the population will be included under these rubric of addiction, because 25 to 30% of the population are obese, or smoke, or drink over the recommended level of units, which are all, of course, these are overlapping categories, which comes to this historical point, which is made very well here, that you're talking about the problem society has in dealing with particular sorts of people, as well as particular sorts of substances, but that's a wider discussion.
Okay, thanks, Roger.
Can I pick up the bit about character rather than morality? And I was listening quite carefully, and you were talking, and then you went on about that Mill was a teetotaler, and I misheard you. I thought you said Neil was a teetotaler. And I was going to say he's not, because I went out with a couple of beers with him last night. Which, you know, is this touches on this inconsistency. I was quite intrigued by what you were saying about character. And actually, maybe it's not so much about character, but about the underpinning values that make up character. And that seems to me is about what we're trying to arrive at, is what is our underpinning set of values that we have that define it. Some people will call it morality. I just think there's a whole series of things that we have that make that up. And to me, I think, is if we can think about those values of self-responsibility, of personal growth as people go through maturation and things like that, about liberty and freedom, self-choice, all those sorts of things. But the other practical ones about how do we control and minimise harms and things like that to others and damage. Don't do others to damage. Don't do damage to others. That set of values, whether that makes character, whether that's a euphemism for morality, I don't know. But it seems to me that it's those constructs that we're struggling with, and all I plead for is that we have a degree of consistency when we're dealing with essentially psychoactive, mind-altering substances. And it will come tomorrow, I guess, in the debate that happens about cognitive enhancers as well.
Okay, thanks.
I very briefly, you know, like Roger, the term that kind of resonated from that was mentioned is that question of character, because it seems almost quaint in a way and somewhat misplaced, as if somehow or other you'd have to be aged over 60 to even use the term character. And yet, of course, so much about life is wrapped up in that notion, that question that at various stages in our lives we put to ourselves as what is the person that we have become, or what is the person we want to be, or what are the things that we've done that we regret having done. And those are the questions which are formative in our identity. And so there is a degree which I think that character can be used as an alternative to morality in this debate. The only other thing that I wanted to say was that I felt there is a degree to which Roger wants his drug policy cake and to eat it. That he wants a drug policy which is pragmatic, which seems to imply that it doesn't matter what you do, but we bear a moral responsibility as a society to help you when you get into difficulty as a result of the choices that you've made. Now, whilst I agree that we as a society do bear a responsibility to help people when they get into difficulty, I think it's quite wrong and misplaced to take morality out of the equation about do you use the drugs in the first place that got you into the difficulties which you're now looking to society to resolve. I think that we do need to resurrect that debate, as I said, internally and externally, about the morality of the choices that we make, you make, I make, our children make, about are we going to use the drugs that are available now and that will become increasingly available in the future. And that is a deeply moral question, which, as I say, our political leaders run shy of, because they, in a sense, they're so frightened about offending people, they don't even want to have the debate itself. And yet, at heart, it is a debate which we must have if we are going to fashion any kind of response to the issue of illegal drug use, recreational or otherwise.
Okay, thank you. Where are the microphones? Can you come down here quickly? Can I take the lady in the green top here?
I was just wondering what the panel thought about the argument the government won't decriminalise alcohol smoking because of the profits, and whether they think it's morally right for a government to take revenue from habits which harm the health of the nation.
Okay, could I have a microphone over here, please? Take the lady in the blue top and then pass it behind you to the gentleman in the blue jumper.
Okay, I think when you're talking about morality, something that has very briefly been touched on is that it inherently means that you're talking about social responsibility as well, about your own actions and the impact on others. And I just wondered, firstly, what you think of the social responsibility of those at source, say the people who end up providing the drugs to people who take them. I know there's a campaigner, Theo van Dam. I remember hearing him speak quite recently about an experiment which has taken place in the Netherlands, where essentially there's corporate responsibility being placed on dealers, where they have safe houses, where they agree that the police will not raid and they will not monitor who goes there, in exchange for training in terms of managing people who OD, and in terms of making sure that they don't keep supplying to the same person, and it basically putting some of the responsibility on people who provide the drugs. I just wondered what you thought about that kind of experiment, and also whether having things like, say, injecting houses as they have in Vancouver, for example, whether that's a good thing, or by providing something like that on the state, you are taking the responsibility away because you're providing this kind of, you're saying what you're doing is right and it's socially acceptable to do it if you're provided a safe place by the state that's monitored by nurses and everything like that. I just wonder what you thought.
Okay, pass that back to the gentleman in the blue jumper and then forward to this guy.
Yeah, hi, this is a half-formed thought and it's a question. The question is your mind your high? And my question is, by taking drugs, by taking external things, is it your mind? And we've been talking about character, free will, responsibility. Is it by taking those things that it is no longer your sole mind, and that's why it's morally wrong?
Okay, thanks. So, yeah.
And we've said that we want to use the term character instead of morality in this debate, but I certainly don't think they're the same thing. I think that the part of character which is outwardly orientated to the community, that's where morality is. So an act is moral if it goes along with your contract that we have with each other to live in a moral community. And I think by reducing this to merely character, we do lose that sense of what we as a society take to be moral. And I think that's actually why I wouldn't say that taking these internal hallucinogenic drugs, that one of the first questions discussed, is immoral. It might affect your character, it might be detrimental to your character, but it doesn't violate any contract that we have between ourselves to act as moral beings. And I think that reduction of character, that reduction of morality to character actually loses that sense of community which goes along with morality. Secondly, just a quick example, we do live in this paradoxical situation at the moment where decriminalising and making things and stopping things from being illegal actually does imply greater regulation. The best example of that is Brighton. Brighton had this movement to legalise cannabis, but if you look any closer to the policy proposals, it effectively meant setting up these areas where people could legally take cannabis on the condition that they then had all these sort of interventions from their GP and from other local authorities as to how they took cannabis. And the problem is that when you decriminalise something nowadays, it's not in the name of freedom, it's not in the name of people actually being able to take drugs, it's so the state can actually get more involved.
Thank you. Can I take this hand here? Yeah? No, sorry, back.
Thank you. I just wanted to question what, sorry, I think that maybe Neil is misunderstanding Roger a little bit when he talks about pragmatism, because what I understand pragmatism to be is that different people are more or less responsible to take drugs, because, for example, if I'm going to drink, I know that my moral spectrum, how bad or how well it can turn out, is limited. I'm not going to do something so phenomenally stupid that it's going to affect, I don't know, my society, I'm going to hurt something like that. But there are individuals who engage in that behaviour on a regular basis, and I just think that how are you going to, classify this debate talking about drug use in general when the affects the spectrum, the potential to be so varied. I know that a friend of mine has restricted her boyfriend from smoking cannabis because he gets very, very strange when he takes it. But that's his individual potential to be very bad when he takes cannabis. Some other people might not have that. And so it does it again, we have to talk about the character of the individual in this debate rather than just talking about the collectives as a whole. And statistics are good, but they only inform me about what might possibly happen. That's still my individual choice at the end of the day, and I think that we need to focus on individuality rather than just talk about collectives and everything like that.
Okay, thank you. Can I take this?
Thank you. Simon Rocco. I'm surprised that no one's talked about how being morally wrong is half the attractiveness of taking recreational drugs in the first place. But I just thought a couple of things. The whole point about battle of ideas, I think, during the libertarian approach to this is to make things better, to move things on, try and come up with solutions. It does strike me that we're talking about the stick and not the carrot here, and that trying to I don't know, tackle this debate whether morally or medically is like trying to stuff the genie back in the bottle. It does, interested, a young lady over there mentioned the historical perspective on this, and if you look back, and let's just say that recreational drug use includes alcohol for the sake of this argument, if you look back historically, the biggest single fall in drinking in the UK was at the end of last century. It happens at a time when another new drug was being popularised, and that was tea. Caffeine. It had the single biggest effect, and people mistakenly think it was to do with the societies who, I can't remember what they call people who... Sorry?
Temperance.
Temperance, they're the fellows, thank you very much. And I think the other point I want to make is that, booze and fags and things like that have been around for a very long time and have not been innovated. They've not been great areas for innovation. But recreational drugs, whether or not they're legal or illegal, are actually where the innovation is happening. And the likelihood of being able to come up with better drugs is much more likely there than it is in the incumbent industries around booze and cigarettes.
Okay, thank you. I'm very sorry. We're going to have to come back and let our panel sum up now. So could I ask you to give us 2 minutes, Roger?
Yeah, I think the innovation, I've not thought about that one before. I think that's an interesting dynamic there. Just a couple of thoughts, one on this. One is, I think what this debate has shown to me is, is about the bell curve distribution of morality and the breadth there. And the question it poses, is pragmatically for me, who and how we decide what has primacy in this, and how we weigh these up. And again, I make the plea for the cause that one. The current approach is not value-free, is not it's steeped in it, and I re-emphasise that. I think the second point for me is about, and the point made over there about a few years ago about how moral values change is really, really important. And I think, about safe injecting houses, the Canadian Supreme Court has decided absolutely unanimously that these are a good thing, that the evidence works. And there's been a lot of political challenge to that. So legally, they are okay now in Canada. So again, that's something that was perceived as being perhaps morally wrong, but has now got a legal backing to it. So, where does morality, what morality, whose morality come into that? And I think for me, I think the final thing, the comment made there about the genie in the bottle. I mean, Neil and others were talking about character being a quaint construct. I mean, to me, in a way, some of the debate is a quaint construct about moral values. There are people, there are entrepreneurs, not necessarily organised criminals like in Mexico or Colombia, but people in Southeast Asia, businessmen, chemical engineers and entrepreneurs who are moving ahead far faster than the moral debate is going to be able to resolve itself. How do we deal with that at a pragmatic level? Other than having erudite debates like this will get us so far. I say, we have to get out there and make some very pragmatic, bureaucratic responses to that, however much Neil might dislike it. So that does mean some very practical things on the ground that people might find morally reprehensible, but hey, saving life is damn important to me.
Okay, thank you.
So just a couple of things. I think it was said before that why the comedians who used LSD have tell the best jokes and the ones who haven't tell the worst jokes. And I think that's probably right, although I'm not sure what the evidence of that is. But what I would say about that, in a way, is that the moral choices that one makes are almost always difficult choices. And in a way, that's how you know they're moral choices, because they're choices where there's maybe a strong personal inclination to do one thing, rather than a small, quiet voice saying, no, don't do it, or do something different. And if they weren't hard choices to make, they wouldn't, in a sense, be moral choices. If one, if one pursues the pleasure argument, yes, there might always be a pleasurable reason to do something, and on the other side of that equation, might seem quite inconsequential that you deny yourself that pleasure, but actually maybe in that denial lies the moral judgment that one makes. But the only other thing I'd say is that one of the things I think is always interesting about this whole area about morality is the genuine difficulty of grappling with many of the dilemmas that one confronts. So, for example, in relation to drug use and drug-related deaths, we have a policy, a UK policy, which aspires to reduce the number of addict deaths. Now, the best way to reduce the numbers of addict deaths, you might say, is actually to provide drug users with the means to use their drugs, to provide them with pharmaceutically prepared drugs in situations where there are medical staff on hand to meet their needs if and when they get into difficulty as a result of that drug use. There is a series of moral judgments that one's made there about what one's going to do, but where you arrive at the end of that is a situation when you're actually providing the very means to use the problem that your policy might otherwise have been trying to reduce its occurrence. So you do confront inherently complex moral issues about how one is going to respond to the problems which drug use generates. And I think that the moral debate about use is truly reflected in the moral debate about what are you going to do as a result of that use. And ultimately, you may arrive at a situation where you say, I am not responsible for the addict who kills him or herself as a result of the drug use that they take. I can't be responsible for that if being responsible means I have to then take on the responsibility of providing the drugs which that individual might otherwise kill themselves as a result of using. Ultimately, if the individual is engaging in a behaviour which may threaten their life, it is their judgment which they are making at some point, and I can't take that judgment on as a moral burden. But I think this area is fascinating because it challenges, in many ways, very fundamental notions about how much are we responsible for the behaviours of other people, and how much are individuals responsible for their own behaviours.
Okay, thank you, Mike.
Well, I agree with that, but I think it's also important to add into the equation if you're looking at the pragmatic effects of drug treatment policies, for example, for example, the fact that it's arguable whether more people die as a result of the methadone program than die from heroin abuse in certain areas at certain times. That case could certainly be made. There's a lot of points being made, obviously it's very difficult to come onto that, more than a couple of them, but just on the harm minimisation policies that you raised, those sort of policies always have a great pragmatic appeal. It makes a lot of sense, the drug needle exchanges, all the rest of it. It has the inescapable problem that you made here of what it does is it extends a framework of regulation around a whole pattern of behaviour which inevitably reinforces and encourages it and will sustain it indefinitely. It also creates a whole layer of professionals who have every interest in the continuation of that behaviour. And so the overall result of this whole thing may well be simply to perpetuate the problem, and that the wider problem that I tried to emphasise at the beginning is it does seem to me that it's simply removing the responsibility for the behaviour from the person themselves. And the more you do that in more different ways across all these issues, the more problems you're going to have. Drugs come and go. People made this point historically, and there are different drugs and all sorts of different things. And you can cite all sorts of different examples, and people cite all sorts of different models. The Portugal model is very popular at the moment. The Netherlands model is popular. People want to apply different things from different places. But each of them, I think, tells you something about the wider culture in which it appears. And one of the, somebody just mentioned ketamine, which I haven't really discussed at all. It seems to be the ketamine phenomenon, quite interesting, because that's not a new drug at all. But it's, the ketamine cult seems to me to reflect a particularly bleak and morbid aspect of our contemporary culture, that has become a particular, the pursuit of near-death experiences, the K-hole, that is the part of the whole ketamine thing, tremendously self-destructive, inherent kind of drug that has become very popular. It's not a mind-enhancing drug in any sense at all. And that's interesting, that tells you something about a particular cultural, historical moment, it seems to me. And I think that simply underlines the importance of trying to foster a wider social, cultural, moral response to this problem, rather than leaving it as it is at the moment to the doctors and the politicians and the lawyers who have certainly got no answers to it.
Okay, can we thank our panel, please?